Anatomical and physiological features of the digestive system in children. Semiotics. The digestive system is a single anatomical and functional complex that includes the digestive canal, liver, and pancreas. Embryogenesis. Rudimentation on the 7-8th day of intrauterine development from the ectoderm. Division of the primary intestine into the intragerm and extragerm occurs on the 12th day. Oropharyngeal membrane formation on the 3rd week. Cloacal membrane formation on the 3rd month. The formation of all parts of the digestive system on the 4th week. Features of the oral cavity in newborns. Relatively small, the tongue is wide, relatively large, no teeth, big fat lumps, the sucking reflex is well expressed, distal position of the lower jaw. Oral mucosa is relatively dry because the salivary glands are insufficiently developed and poorly functioning at the time of birth. Rich in blood vessels, epithelium of the mucous membrane is very dry. Reaction of the saliva of newborns is slightly acidic, so there are many cases of the stomatitis in infants. Factors contributing to the act of sucking in infants. Act of sucking in infants, especially in newborns, is a very important act. So, factors contributing to this act. Oral cavity is relatively small. The palate is flattened. A white tongue, which is relatively larger than that of adults. Chewing muscles and lip muscles are well developed. Fat lumps of beach, which provide elasticity to the cheeks. Visible part of the lip mucosa has a transverse folding. Act of sucking in children consists of 3 phases. The phase of aspiration, grasping mother's breast, the phase of squeezing the nipple and areoles. Every act of sucking, milk moves into the mouth, and the phase of swallowing, one swallowing movement after several sucking movements. Features of the esophagus in children. Before birth, esophagus is mostly formed. The length of esophagus in newborns is about 10-12 centimeters. Topographically, it begins 2 vertebral bodies higher than in adults, and this feature provides conditions for almost simultaneous swallowing and breathing. The mucous membrane is dry and tender. Glands almost do not function. The elastic fibers and the muscle layer poorly developed, so peristalsis of the esophagus is not formed. It can only pass liquid food, like milk. Mucous membrane has a well-defined folding, which leads to a complete closure of its walls at rest. Outside of the act of swallowing, the passage of the pharynx into the esophagus is closed. Lack of dense coverage of the esophagus with the legs of diaphragm in all newborns contributes to frequent regurgitation. Anatomical features of the stomach in children. The cardiac part is not developed. The muscle fibers of the inner oblique layer are weak. That contributes to the drawing of its content into the esophagus. Regurgitation and the development of peptic ulcers of the esophageal mucosa in children of the first year of life, especially first 6 months. In children of the first months of life, stomach has a form of inverted bottle due to poorly developed cardiac part and well-developed pyloric part. The stomach has no definite shape. It varies depending on the feeding and the nature of the food. The body of stomach is poorly developed. During the first year of life, there is an intensive growth of the body and the pyloric part of the stomach. Stomach located more horizontally than in adults. At the end of the first year of life, it acquires an upright position. On this picture, you can see horizontal position of the stomach in your bones. In this slide, you can see shape of stomach in your bones without definite shape, depend on amount of food. No definite shape due to poorly developed muscle layer. Volume of the stomach in different ages. Newborn 7 to 80 ml, 1 to 2 months baby 80-100 ml, at 1 year old 250 ml, 4 to 7 years 400-600 ml, and after 8 years old 1 liter. These indicators you can use for prescribing diet. Regurgitation is the frequent act in babies, especially first 6 months. Causes of a predisposition to regurgitation. Esophagus is not covered tightly by the legs of diaphragm. Weakness of the cardiac sphincter with a well-developed pyloric. Horizontal enlargement of the stomach. High pressure in the abdominal cavity. Horizontal position of the child. Large amount of food. The daily amount of food is 1/5 of the child's body weight. Stomach functions. Many functions: secretory, mechanical, endocrine, resorptive, excretory, and protective functions. All of these functions poorly developed. Only one resorptive function, absorption of proteins, of water, electrolytes, and a number of chemicals, well developed. And this feature can lead to allergic reactions in babies. Activity of the enzymes is reduced. The pH is higher. Among proteolytic enzymes, the effect of renin will be higher in newborns because this enzyme is active when pH 6.5. Fetal pepsin will be active when pH 3.5. Pepsin C or gastrixin will be active when pH 3.2, and only on the end of the first year of life, pepsin of adults will be active because pH gradually decreases, and on the end of the first year of life will be like in adults. Pancreas in children. Location In newborns, the head of the pancreas is projected to the right of the white line of the abdomen, 1.53 centimeter above the navel. The body and tail to the left of the white line and above the navel by 2.5, 4.5 centimeter. Lymphatic vessels are associated with the neighboring organs, which leads to the generation of an inflammatory process. Pancreas functions: exocrine, secretion of pancreatic juice with digestive enzymes, endocrine, secretion of hormones, and excretion of metabolic products and foreign substances. Exocrine function. Pancreatic juice is a colorless liquid of an alkaline reaction which contains organic, inorganic components and enzymes. In newborns, hemolytic activity is very low, reflecting the involuntary part of milk nutrition. After the introduction of complementary foods, hemolysis activity increases 25-50 times. Pancreatic enzymes: trypsin, hemotrypsin, carbopeptidase, elastase break down proteins. Amylase breaks down starch and glycogen to form of maltose. Maltase breaks down maltose, and lipase breaks down emulsified fats. Activity and amount of all enzymes is low in babies. Endocrine function: secretion of insulin, glucagon, pancreatic polypeptide, somatostatin. In newborns, especially in the first days of life, very low. Liver. Anatomical features: the weight of liver in newborns is 1/18 of the body weight. In adults, 1/50. So, liver in newborns relatively large. The gallbladder of newborns is about 3 centimeters long, volume less than 3 ml, and has a fusiform shape. And by the 6-7 months of life, it becomes pear-shaped, capacity doubles. Up to 5 years, the gallbladder is laterally than in adults and has a kink. Functions of the liver: metabolic, metabolism of almost all substances, proteins, carbohydrates, pigments, biologically active substances, hormones, vitamins, trace elements. Secretory function: bile formation. Barrier function: protective and neutralizing. Excretory function: excretion of toxic substances. All of these functions in children, especially in infants, poorly developed, insufficiently developed. About size of liver and palpation. Lower edge of the liver up to 7 years of age along the right midclavicular line is palpable up to 6 months by 2 to 3 centimeter, 6 months to 2 years by 1.5 centimeter, 3 to 7 years old by 0.5, 1 centimeter. After 7 years old, we cannot palpate liver below the ribs arch. On this picture, you can see palpation of liver in children with 2 hands, one of your hand, left hand on the back, and you will palpate with your right hand. Percussion of liver in children is different from adults. We will percuss and assess three sizes by Kurlov. The first size by midclavicular lane, second size by midline, and the third size by a left ribs arch. Formation of the bacterial flora in the intestine. After birth, 16-20 hours after birth, the intestine is sterile. This phase, aseptic phase. Then, through the mouth, upper respiratory tract, and rectum, different types of flora get into the intestinal tract. Coccus flora, gram-positive flora, bifidobacterium, Escherichia coli, proteus, and others. This phase of increasing infection continues up to 3/5 days. And after this period, phase of transformation of intestinal flora begins from the 5th-6th days of the life. This phase, this transformation depend on environment and depend on type of feeding. Babies with breastfeeding, this phase transformation will be fastly. Semiotics of the digestive system's diseases. Aerophagia is the swallowing of air while eating. The child often regurgitates. Small amounts of air and milk are released outside. You already know about causes of the regurgitation. To prevent aspiration during regurgitation, follow the following rules. After feeding, hold the baby for 10-15 minutes at an angle of 45. Then put the baby on its side. In case of regurgitation, content of the stomach will come out. Pain syndrome is the most frequent syndrome in children with digestive tract diseases. So, in this slide, pain syndrome in peptic ulcer disease. Next, pain syndrome in invasive diarrhea. Compiled body position in children with pain syndrome. Next sign, next syndrome, diarrhea, very common in babies. Next, jaundice of the sclera, sign of the liver and gallbladder diseases. Pallor of the skin may be two reasons of the pallor in patients with digestive tract diseases. The first reason, a low level of iron due to malabsorption, and the next, spasm of peripheral vessels due to pain syndrome. Heartburn or pyrosis, a burning sensation behind the sternum and in the upper part of the epigastric region. With esophagitis, esophageal ulcer diseases, gastroduodenitis, and peptic ulcer. Nausea, an unpleasant sensation in the epigastric region, often accompanied by weakness, dizziness, and salivation. Occurs in diseases of the digestive system, sometimes has a conditioned reflex nature. Vomiting, a complex reflex act caused by the excitation of the vomiting center, in which there is an involuntary release of the contents of the stomach outside. A very common sign in babies due to poor development of the muscle layer of the cardiac region called cardiac sphincter, and relatively good development of the pyloric region. On this slide, you can see stool changes in healthy baby during first year of life. First stool, meconium. First stool right now after birth. Green color. Next, this color will be changed, and up to 6 months, normal color of the stool, yellow. After introduction of complementary food, color of the stool changes to brown. Celiac disease, malabsorption syndrome. You can see our patient with celiac disease with severe malnutrition, marasmus, and very large abdomen. Stool changes in this baby. First picture and next picture, a stool with the blood, dysentery. Common methods of examination patients with digestive tract diseases, esophagogastroduodenoscopy and colonoscopy. The lecture is over.